January is National Glaucoma Awareness Month, and Cassandra Duvall talks to a local doctor about risk factors in tonight's Medical Monday segment.
All right, Dr. Benjamin Phillips here with BayCare Clinic. January National Glaucoma Awareness Month. What is glaucoma?
Well, glaucoma is a group of diseases of the eye that is characterized by damage to the optic nerve. In a lot of cases, it has to do with high eye pressure, but the two are not exactly the same thing.
Okay, what does it do? What can it do?
With progressive, gradual damage to the optic nerve, you can actually get vision loss.
Okay.
Oftentimes it's the outside peripheral vision that's lost in the early stages, but at the later stages it can affect your central vision and eventually can cause complete blindness.
Do people know that they have this?
Very often they don't, because in most cases, especially at the early stages, there are no symptoms at all.
Until it gets worse?
Yes. There can be some symptoms associated with very, very high eye pressure like pain, but in most cases there are no symptoms at all. So a person very often doesn't know they have glaucoma.
Do you typically get tested for this, like when you go to the eye doctor or something like that?
It is usually part of a complete eye exam when a person sees an optometrist or an ophthalmologist. Yeah.
Are certain people at a higher risk than others?
For the most part, it's a disease associated with aging, so older people especially, but there are other groups that are at higher risk, such as African Americans, Asian Americans, other conditions associated with it.
And you said too, people over 40 who might have diabetes and certain other medications, right?
Some medications are associated with glaucoma, such as steroids and things like that.
All right, so if you are diagnosed with this, what do? What's treatment like?
Well, once it's identified that there's a problem, and very often the problem is associated with high eye pressure, like I said, and so treatment very often involves lowering the eye pressure somehow, many times with medicated eye drops or sometimes a laser procedure. Occasionally at later stages or in more severe cases, it'd be necessary to do a surgery.
Okay, so that's why it's so important to determine this early.
Yes, or catching it early can minimize the amount of actual vision loss that a person has.
Okay, what happens if it's left untreated?
Well, unfortunately, it many times is untreated if a person doesn't know they have it, and so it's possible for a person to have very significant vision loss.
All right, important to talk to your doctor if you have any kind of pain or anything like that.
Yes, and just having a routine eye exam also is very often what catches it.
All right, thanks so much for being with us, Doc. For more information about Glaucoma Awareness Month, just visit our website and click on this story.